Hello everyone. Here I'll discuss about the gross features of uterus. This section includes the position, relations of the uterus, supports, blood supply and clinical features. Coming to the location of the uterus, what you're seeing, this is the superior view of this pelvis, this lesser pelvis. This is the anterior. There you can see the bladder. This is the posterior rectum. Okay, this colon, sigmoid colon continuous here. This is the rectum. Okay, see in between this bladder and the rectum, there you can see this one is the uterus. This is the fallopian tube. Okay, ovary. This yellow that is forms the broad ligament. Okay, so in the posteriorly you can see this one is fallopian tube with this ovary. Okay, so location of this uterus. Okay, that is in the lesser pelvis. Coming to this bony pelvis. Okay, here this is the sacrum with coccyx posteriorly, two hip bones side, and this region, this is the pubic symphysis, pubis. Okay, body of the pubis. Okay, forms this one, pubic symphysis. This part is the ileum. From here to here, this is the pubis. This region, this is the ischium. Okay. Then coming to this pelvic inlet or the pelvic brim, the boundaries are the posteriorly, this is the sacral boundary. This is the margins of this anterior margin of this ala of the sacrum. This is the arcuate line. This is the pectinate line. Okay, here this one is this is the pubic crust, upper part of the body, pubic symphysis. Okay, this forms the pelvic inlet. Then inferiorly here we'll get the pelvic outlet. Okay, the space which lies inferior to this pelvic brim, that forms the lesser pelvis or the true pelvis. So location of this uterus in the lesser pelvis between the urinary bladder anteriorly and the rectum posteriorly. Then here we are seeing the sagittal view of the female pelvis, anterior pubic symphysis. This is the posterior aspect. You can see this is the sacrum. This one is the coccyx. Here you can see that it is the rectum. This is the anal canal. Okay, anal orifice, urinary bladder, urethra, urethral orifice. See the uterus. This is the vagina, vaginal orifice. This is part of this labium majus, uterine tube, fallopian tube with this ovary. This is in the lesser pelvis. Okay. Additional to that, you can see here the part of the uterus from here to here, the expanded part, that is the body. Here the cylindrical part, that is the cervix. It bends forwards, little downwards towards the superior surface of this urinary bladder. Here, coming to the normal position of this uterus, okay, that is the anteverted and anteflexed position. Okay, see the bladder anteriorly. Okay, so this is the uterus. This part is the body. Here, this is the cervix. Okay, this is the vagina. This part is the vagina. Okay, coming to this anteversion, there is the angle between the long axis of this cervix. See, this is in red color. That is the long axis of the cervix, and the long axis of the vagina, that is in blue color. Long axis of the vagina. That meeting point here, that forms the angle of the anteversion. It's 90 degree. The help, it bends forwards. Okay. Then anteflexion, angle of anteflexion, that is the long axis through the body of the uterus. See, that is in the green color, body of the uterus. Then long axis through this cervix, that is in red color. Here, that means this is the angle of the anteflexion. That is the average, that angle is 125. Okay, it ranges between 120 to 170 degree. Okay, it bends downwards. Okay, so that is about the anteverted and anteflexed angle of the uterus. This angle is important. It prevents the uterus from sagging down into this vagina. So here also same, that is the angle of this anteversion and the angle of this anteflexion. Okay, forwards, downwards towards this urinary bladder. Then coming to the parts of the uterus, okay, now seeing this is the coronal view, that is the posterior view. Okay, see, this is the uterus. From here to here, this is the body. This part is the cervix. Okay, so you can see the uterine tube with the ovary. This ligament, peritoneum fold, that is the broad ligament. That is the broad ligament. In the posterior layer of this broad ligament, there you can see this is the ovary. Okay, so its parts are the, here this is the lateral surface, this is the lateral surface. You can see the upper, there you can see the fallopian tube will be there. Is there. This region, this is the lateral angle. Okay, the part of the uterus above this lateral angle, that is the fundus. It's a dome shaped part. Okay, part here, that is the body. The constrictor region here, that is the isthmus. This part is the isthmus. Okay, then this is the cervix. Okay, it is projecting into the walls of the vagina, the cervix. Okay, then here, this is the uterine cavity. This is the uterine cavity. It is triangular in sections. This is triangular. It communicates superiorly with this fallopian tube and inferiorly with this vagina. The cavity of the cervix, that is called the, this is the cervical canal. It's opening into the vagina, that is that region, that is called the external os. That is called the external os. Okay, it's opening here to this uterine cavity, that is here, that is called the internal os. Okay, so the cervical canal is between this internal os and this one, that is the external os. Then in this figure, first one, that is the coronal view, second is this one is the sagittal view. Okay, here you can see this part is the fundus, this is the body, this part is the cervix, this is the vagina, this is the uterine cavity, this is the internal os, this is the external os. Okay, so the cervix is projecting into the walls of the vagina and forming spaces are called the fornices or fornix. Okay, in the coronal view you can see in each sides, these are the lateral fornix. In the sagittal view, this is anteriorly, this is the anterior fornix. Posteriorly, this is the posterior fornix. These are the spaces. Okay. Then coming to the parts of the cervix, okay, the part projects into the vagina, that forms the, that is the vaginal part of the cervix. Above that, that is the supravaginal part. Okay, that is the supravaginal part and the vaginal part. Okay. Then here you can see the mucosal ridges are called in the cervical canal. Those are called the arbovitae uteri. This longitudinal ridges with lateral force. Okay, those forms this arbovitae uteri, which helps to close this cervical canal. Here coming to this external os, difference of shape of the external os in this nulliparous and the multiparous women. In the nulliparous, it is small, round. Okay, in multiparous who give birth, okay, this opening appears as expanded, wide. It's in the form of a slit. Okay, and also it appears in the form of a fish mouth. Okay, there's a difference of this cervix uteri in nulliparous and multiparous. Then coming to the relations, this peritoneal relations first. Peritoneum, this is the serous membrane which lines this abdominal and this pelvic cavities. Okay, forms the parietal layer and visceral layer. Okay, it's forms peritoneal folds. Okay, it relates to the uterus posteriorly and anteriorly. Okay, it's the anterior aspect. See this posterior aspect, sacrum coccyx. Here you can see rectum. This is the urinary bladder. Okay, see this is the uterus. Okay, this surface, this is the posterior surface. This is the anterior surface of the uterus. Okay. Addition to that, you can see the peritoneal fold from here in the upper and middle third of this rectum. Okay, towards this upper part of this vagina forms the rectovaginal fold towards the posterior surface of this uterus, towards the anterior surface of this body of the uterus, then towards the superior surface of this bladder, then to the pelvic wall. Okay, so this peritoneal fold in the posterior aspect that forms the rectovaginal fold. Okay, in the anterior aspect that forms the vesicouterine fold. Okay, the space in the posterior aspect that is called the rectouterine pouch of Douglas, in the anterior that forms the uterovesical pouch. Okay, this rectouterine pouch, okay, that anterior boundary of this pouch of the space is, this is the posterior surface of this uterus. Posteriorly, that is the anterior of the upper and middle third of this rectum. Okay, this base which lies somewhat 5 centimeter above this anal orifice. Okay, and also if there is any infection or inflammation is there, fluid with pus or this blood tends to collect in this rectouterine pouch, as it acts as the most dependent part of this peritoneal cavity. It can be drained either through this anus or through this vagina. Okay. Then this uterovesical pouch is the anterior boundary, that is, this is the superior surface of the bladder. Posteriorly, there is the anterior surface of this body of the uterus. So that's about this peritoneal relations. Then here you can see the lateral surface. See, this is also this the posterior view. The lateral surface, here you can see this is the lateral surface. There a peritoneal fold attached, that is called the broad ligament. Okay. Then so this broad ligament, it's a double layer fold of peritoneum. Has two surfaces. I told this is the posterior view. So this is the posterior layer of the broad ligament. Towards like that. Anterior surface of this uterus body. There will be the anterior layer of the broad ligament. Okay. Then this broad ligament has a lateral and inferior border. See, this is the lateral and inferior border which attached to this corresponding this pelvic wall. This is the superior border of this broad ligament where this anterior surface and posterior surface meets, and it's a free border. There you can see this is the uterine tube. Okay. So in the posterior layer of the broad ligament, you can see this is the ovary with this ovarian ligament and this suspensory ligament attached to this lateral pelvic wall. Okay. Then coming to this subtypes of this broad ligament, here you can see this is the ankle of the uterus. Okay, there you can see this is the fallopian tube is there. Okay, this is the ovary. Okay, this is the lower end of the ovary is attached to this lateral surface of the uterus by means of a ligament that is called the ovarian ligament. Okay, the part of the broad ligament above this ovarian ligament and between this fallopian tube, this part is called the mesosalpinx. That is called the mesosalpinx. Okay, the part of the broad ligament just below this ovarian ligament, this region, that is called the mesometrium. That is called the mesometrium. Okay, that's about the broad ligament. Then next is the contents of this broad ligament. Okay, here you can see this is also the posterior layer. This is the uterus. Here you can see this is the uterine tube. See, this is the ovarian ligament. So contents are this is the uterine tube or the fallopian tube, ovarian ligament. Okay. Then antero-inferior of this broad ligament, that will get the round ligament of the uterus. Then you can see the nerves, vessels, everything. Here you can see the nerves. Okay, uterine vessels and the nerve plexus, lymphatics, and this one remnants of the mesonephric ducts will be there. These forms the contents of this broad ligament. Then this relations. Here this is the anterior, this is the posterior, this is the uterus. Anteriorly, this is the urinary bladder, superior and superior surface and the base of the bladder. Posteriorly, upper and middle third of this rectum. Superiorly, will get the coils of this ileum and the sigmoid colon. These forms the visceral relations. Then next is the supports of the uterus. Okay, so uterus, it's a mobile organ, okay, which undergoes extensive changes in the size and shape during the fertile period of female life. So it is supported from sagging down to the vagina by a number of factors, okay, which forms the primary and the secondary supports. Primary supports includes the fibromuscular supports. Those are the ligaments and the condensations of the pelvic fascia are the uterosacral, transocervical, pubocervical ligaments. Muscular supports or mechanical supports includes the pelvic diaphragm, urogenital diaphragm, and the perineal body. Then accessory supports. The secondary supports are the peritoneal folds, broad ligament, rectouterine, and uterovesical fold of peritoneum. These three we already explained. Okay. Then coming to this primary supports. Okay. Here through this cross section, okay, you can see this primary supports, these ligaments, these uterosacral, transocervical, pubocervical ligaments. These are the condensations of the pelvic fascia. Okay, so pelvic floor is made up of two important muscles. One is this one coccygeus and this levator cranium muscle will be there. Okay, so this anteriorly, this is the bladder, this is the cervix, this one is the rectum. From the cervix, okay, towards each sides, towards laterally, a fan shaped condensation of the pelvic fascia forms, that is the transverse cervical ligament to this lateral, this pelvic wall attached. It's also called the McEnroe's ligament or cardinal ligament. Okay, anteriorly from the cervix to this posterior surface of the pubis, okay, one ligament is there, that is the pubocervical ligament. Posteriorly from the cervix to this posterior of the anterior of the sacrum, that is towards the second and third segments of this sacral vertebrae, a ligament attached, okay, that condensation of that fascia that forms the uterosacral ligament. Here you can see this is the transocervical you can see here. Then there is the pubocervical ligament. This is a pubocervical ligament. Okay, then here we'll get the uterosacral ligament. This is the uterosacral ligament. Okay, then here there is a fibromuscular support. Okay, this is the anterior, this is the posterior, urinary bladder, this is uterus, uterine tube, this ovary. The antero-inferior, okay, of this fundus, okay, there will get the east sides and the lateral surface. Okay, there will be the round ligament goes laterally, then to this deep inguinal ring, to the inguinal canal, exit through this superficial inguinal ring, this region, this is the inguinal region, then it merges with this connective tissue of this labium majus as dividing into numerous septa. That ligament is called the round ligament. Okay, from the antero-inferior of this uterine tube. So this round ligament which pulls the uterus forwards, okay, and the uterosacral we have seen in the previous figure, which pulls the uterus backwards. These two ligaments maintains the angle of the anteversion. So important, okay. Then here also you can see this the round ligament, okay, this is the anterior, posterior, bladder, uterus. This is the fallopian tube. From this, here you can see this is the round ligament from the anteroinferior of this uterine tube, okay, goes laterally, exit through the superficial inguinal ring, okay. Then here you can see both the round ligament. This is the round ligament anteroinferiorly of this fallopian tube. This is the broad ligament. Here you can see this is the posterior from the cervix. This is the uterosacral ligament, okay. One round ligament pulls the uterus forwards. This uterosacral pulls the ligament pulls the uterus backwards, which maintains the angle of the anteversion. Then coming to this mechanical supports or the muscular supports, okay. This is a coronal view, okay. Here this is the uterus, cervix, this is the vagina, this is the vestibule, okay. This muscle, this is the levator muscle, that is the levator, okay. Here this is the ischiopubic ramus, okay. This is the vagina, okay. Then you can see this is the urogenital diaphragm, that is the urogenital diaphragm. It's made up of superior and inferior fascia of this muscles, okay. There is the superior fascia of the urogenital diaphragm, inferior fascia of the urogenital diaphragm or the perineal membrane. It contains the muscles are the deep transverse perineum, okay. Then the sphincter urethrae muscle, okay, that is the external urethral sphincter urethrae muscle, okay. This diaphragm, this urogenital diaphragm is traversed by this vagina and gives passage to this urethra, okay, which supports this vagina, okay. Then in this figure, next one, here what you are seeing, this is the pelvic floor, okay, pelvic floor. Here you can see pelvic brim. This is the ischial spine, okay. Here this is the levator muscle, from here to here the levator. Posteriorly we can see this that is the piriformis. This levator includes, okay, this anteriorly that muscle that is called from the posterior surface of the pubis, this part of the muscle, that is the pubococcygis, okay. From here this is the ilium, okay. This is the iliacoccygis, okay. This one is the ischiococcygis or coccygis, okay. This is the piriformis, okay. So this forms the pelvic floor, okay. Here you can see this is the rectum, the vagina, the urethra can see. See the pubococcygis forms fibers around this vagina, that forms the pubovaginalis, and this rectum that forms the puborectalis, okay. This also supports the uterus. Here you can see this is the perineal body. There is a fibromuscular nodular structure or fibromuscular mass between this. This is the perineum. This is the pelvic outlet, okay. Here you can see this is the urogenital triangle. Then this one, this is the anal triangle, okay. So perineal body is a fibromuscular node between this urogenital triangle and the anal triangle. It lies median, okay. There are some 10 muscles converged to this perineal body, okay, which includes the 4 paired and 2 unpaired, okay. Those muscles are the, here you can see this is the bulbospongiosus muscle. This is the bulbospongiosus muscle in each sides. This is the superficial transverse perineum. Deep to that will get the deep transverse perineum. This is the puborectalis part of this This is the pubococcygis part of this one, levator muscle. Okay, then unpaired, this is the external, this is the anal sphincter. Then also there is the longitudinal muscle cord of this rectum and the anal canal that is not there in this figure. These 10 muscles converse to this perineal body, okay, which helps to anchor the pelvic floor muscles, which maintains the integrity of the pelvic floor, this perineal body. Okay. That's about the supports of the uterus. Okay. Then here you can see the blood supply of the uterus. See, this is the uterine arteries coming. See this again. This is the posterior view. Okay, uterine artery. So uterine artery is a branch from this internal iliac artery. Okay, it is tortuous. Okay, so uterus increases in size and shape. Okay, so to provide sufficient blood supply, the artery is highly tortuous. Okay. Then here in the upper aspect, you can see through the suspensory ligament of this ovary, there comes the ovarian artery. It's a branch from this abdominal aorta. Okay. Here in this lateral angle, these two meets anastomosis with each other, ovarian artery and the uterine artery. Venous drainage to this uterine veins. Here in the upper, there is drainage to the ovarian vein. Okay, that final drainage is different actually in both each sides, right and left. Okay. Then here you can see the uterine vessels at the level of the cervix. Okay, this internal os. Okay, the posterior to the uterine vessels, which lies there, is the ureter lies, which lies 1.25 centimeter lateral to this internal os. Okay, it's at the level of the internal os, 1.25 centimeter lateral to this lateral surface of this uterus. Okay, posteriorly we'll get the ureter. So during hysterectomy, one should be careful not to give injury to this ureter. Okay. That's about the blood supply. Then nerve supply. Nerve supply, that is through the sympathetic, and this one is the parasympathetic. Okay, parasympathetic, that is through the this one, that is the pelvic splanchnic nerves. Okay, then sympathetic is to the T10 to L1 segments through the inferior hypogastric plexus. Okay, T10 to L1 segments of the spinal cord. Okay, so labor pain, it gets referred to the area of the skin supplied by these segments. Okay. Then lymphatic drainage. Here you can see the lymphatic drainage. This is the body. It drains into this lymph nodes in front and sides of the aorta, that is pre and para-aortic lymph nodes, then towards this external and internal iliac lymph nodes. Okay, then also to the sacral lymph nodes. Okay, so here from this lateral angle, it drains into this one, that is towards the superficial inguinal lymph nodes. Then coming to this clinical features, the prolapse of the uterus. Okay, so the uterus main supports are the axis of the uterus itself, that is the angle of the anteversion. It's maintained by this that is the round ligament and the uterosacral ligaments. Then its muscular supports are the pelvic floor muscles, that is the levator, that is mainly the pubococcygis part of the levator, then perineal body. So during parturition, there can be damage to this perineal body and this pubococcygis part of this levator muscles. So if it is not properly repaired, okay, there is the sagging down of this uterus towards this vagina. That condition is called the prolapse of the uterus. It is common in the multiparous women who give much burst childbirth. Okay. Then here you can see this is the fibroids. These are the abnormal growths you can see on the inside and the outside of the uterus. Okay, so these are benign. If it is in the outside, it's called the subserous fibroids. Okay, and the muscle cord, it is called the intramural fibroid. Okay, then in the mucosa, that forms the submucosal fibroid. This is submucosal. This is the uterine cavity. It's lined with this region, mucosal lining, that is called the endometrium. Okay. Then here also you can see this the endometriosis or the chocolate cyst, okay, filled with blood. Okay, you can see over the surface or the bladder, this one ovary onto the uterine tube. Okay, those cysts are called endometrial cyst, collectively endometriosis. Okay, one possible theory explaining of this endometriosis is there is a black flow of the menstrual blood, okay, towards this tube into the pelvic cavity, forms this cyst. Okay, these all are response to these all response to the estrogen hormones. Okay, that's all. Hope you understood. Okay, here this uterus can ask for a long essay. Okay, so describe the uterus under the following headings: its position, okay, its axis of the uterus, okay, then its relations, peritoneal relations, visceral relations, supports, primary supports, fibromuscular and muscular supports with secondary supports, its blood supply and some applied anatomy. Then this pouch of Douglas and a broad ligament can also ask for short notes. Thank you.